Hello everyone, Dan Rexroth again, and I'm here with Danielle Heffron, who is the clinical manager for Village Hospice, such an important service for the village, and we're here to talk a little bit about Village Hospice response to COVID-19. Why don't you talk to us a little bit about changes that you all have made, that your staff has had to adjust to over the course of the last few weeks?
Sure. There's been several, as you said. So we kind of started with the office and looked at that as our central hub, since we do have, we serve all over this metro area, 8 counties, but we wanted to take into consideration how we can decrease the foot traffic in the office. So we really restricted actually who's coming in. We have only 2, maybe 3 people in the office at a time. And when we're in there, we do wear our cloth face coverings as well to protect each other in that setting. We have asked that our field staff coming in, of course they need a lot of supplies, paperwork and things like that, so we've adjusted how we get them those materials. They just send us requests, we bring it to them so that they can be in and out very quickly and on their way. In addition to that, we looked at how we're seeing our patients and their families. We wanted to take into consideration the relative risk of our frequency of visits versus backing off of those visits. So we really took a look at the patients, their caregiving situation, their care setting. If they're in a home setting, they're certainly going to need a little bit more of our presence as opposed to maybe somebody in a long-term care facility. So we took that into consideration and made adjustments there. Of course, when our staff go to visit patients, they wear protective equipment, including a mask, gloves when they're providing that hands-on care, a face shield as well, to protect not only ourselves, but our patients and their families as well.
Great, well thank you, and thanks for protecting the staff and all that you're doing there to make sure that our associates are safe. We also have the other side of the equation, which are the patients and their families. So talk to us a little bit about how the patients and families have responded and what their comfort level and how they have been doing over the past few weeks.
Yeah, that's of course been difficult, as we've seen just all across the community. Of course, we still encounter the same things that the long-term care facility has in independent living as well, in lack of visitors. We can't have our families coming to visit our patients, and obviously, particularly at end of life, that's extremely difficult. There are those exceptions if somebody is actively passing away, family can come. So that has been a nice, change to that. I'm trying to think. It's been.
Have the families been accepting of these restrictions?
Yes, I mean, as much as they can be. Obviously, understanding of why we're doing it, that's really important. I think that they know why we're doing the things we're doing. So a lot of education on that front. And when they know that, they understand that we're doing it to keep them safe, their families safe. So they've been accepting of that. And then we've actually had some patients themselves opt out of certain things. They understand that they're a high-risk population, so they have asked to discontinue maybe some of those less essential services to them. A chaplain service might be discontinued at that time, or music therapy based on a patient's request. So we try to, of course, accommodate that too, and also still meet their needs.
Right.
So we check in calls more frequently, check in calls to the family as well. That helps.
Well, certainly, in hospice, we're dealing with the most vulnerable patient population, and so it's really great. And then, of course, at the end of life, that is a very difficult circumstance, and I think we've all seen and read about, those situations out in the news that they've talked about people dying and dying alone.
Yes.
So your staff is key in that whole situation.
Absolutely.
And the comfort that you can provide, so emotional support in addition to the physical and medical needs.
We will still be there. We would never want somebody to pass alone either, and so when family is unable to step in, we do as well.
Great. Well, thank you, and please pass along my thanks to all the staff and what you've been doing You guys are really, truly everyday heroes. And I think that, there are a lot of us at the Village who are probably able to keep our social distance, but caregivers like you in hospice, that's not always possible. So thank you for taking proper precautions, and thank you for being that family for those patients that right now are not able to see their families. So thank you, Danielle, and keep up the good work.
Thank you.